Good afternoon, everybody, and welcome to Care Connection, the free live webinar. Today we have a very special guest on Valentine's Day, Dr. Edward Shaw. Today's topic is going to be understanding love. Dr. Edward Shaw is duly trained as a physician and mental health counselor. He was a primary care partner for his wife, Rebecca, who was diagnosed with early onset Alzheimer's disease in 2008 at age 53 and passed away in 2016 after a 9-year battle. In 2010, inspired by Rebecca's journey, his medical interest shifted to dementia diagnosis and treatment, and with his additional training in mental health counseling, founded the Memory Counseling Program in 2011. Part of the section on gerontology and geriatric medicine at Wake Forest Baptist Health in Winston-Salem, North Carolina. The program serves individuals, couples, and families affected by Alzheimer's disease and other types of dementia. Before we begin, I just want to let everyone know we will be in listen only mode, that all questions will be taken at the end of today's presentation on the right hand side under questions. In addition, our handouts are also on the right hand side under handouts. So, Dr. Shaw, please begin.
Thank you, Heather, and I want to thank the Alzheimer's Foundation of America for inviting me to do this special Valentine's Day seminar. So I thought it would be appropriate for us to talk about the topic of love, since it is Valentine's Day. And I hope that the presentation offers everybody a different perspective on the topic of love, particularly as it relates to maybe a loved one that you have that you're caring for with dementia, or perhaps you're a person who's experiencing dementia, or you're a healthcare professional who works with this population of patients. So, as Heather mentioned, I direct a counseling program at Wake Forest University School of Medicine and Wake Forest Baptist Health. We're in West Central North Carolina in Winston-Salem, and our program serves individuals diagnosed with any form of dementia, Alzheimer's, and the other common types, as well as their care partners and their family caregivers. So the outline of today's talk, I'll tell you a little bit about our family story with my late wife Rebecca's journey with Alzheimer's disease. We'll talk a bit about emotions and feelings, emphasizing love. We'll talk about the 5 love languages. Some of you may have heard of Dr. Gary Chapman, who was co-author with a book that we wrote together on the use of the 5 love languages in dementia caregiving. So I'll talk about those. And then we'll talk about something that maybe the healthcare professionals are familiar with, but maybe not so much the others listening, and that is something called attachment theory and attachment loss, and what all that has to do with love and some of the challenging behaviors that can occur in people who have dementia. So, and we'll follow, as Heather said, with a time for question and answers. So this is a picture of my family back in, this is taken right after Thanksgiving in 2012, and Rebecca and I are on the left-hand side of your screen. In the middle are our 3 adult daughters who were at that time in their early to middle 20s, and then on the right is my son-in-law, Darren, and our grandson, Paul. And what you would never know looking at Rebecca in this picture is that she is already in the middle stages of Alzheimer's disease. She began with difficulties with memory, but it then became much more pronounced. She couldn't retain new information. She had trouble focusing and concentrating. Her short-term memory was, for all practical purposes, non-existent. She was, by training, a speech pathologist, had a master's degree in speech pathology, and she herself worked with people that had strokes and closed head trauma. And ironically, even as a speech pathologist, her language skills were affected by the Alzheimer's disease, and had a lot of difficulty getting out words and phrases and sentences. And then she was imbalanced. She had some of the spatial challenges that people with dementia had, and she had frequent falls. And so she looks perfectly normal. She's very healthy. She was a swimmer. She was exactly the kind of person who you never would suspect would get Alzheimer's disease. And in 2012, we had been married at that point for 22 years and together for 26 years. We were blessed to be college sweethearts. And when she was diagnosed, what really prompted my career change from being an oncology doctor to being a mental health counselor for people on the dementia journey was the lack of support that our family had, a lack of someone to partner with us on the journey. Not so much the medical side. We had great medical care, but it was all the other things that go along with being a caregiver. And that's why I wound up getting my master's degree in mental health counseling and then starting the center that we have at Wake Forest, the program for caregivers. So for Rebecca and our daughters and I, we were a very close family, and really the challenge we had was as her memory faded, how could we keep the love alive in our relationships with Rebecca? And that's what I really want to talk about for the first part of my presentation today is just the emotional life of somebody who has dementia and the changes in that emotional life, including the perception of feeling loved and giving out love, how the disease changes that. So to do that, we have to talk a little bit about just what human emotions are. And so if you study psychologists who are interested in this area, they'll say that human beings across all cultures through all parts of the world have four core human emotions. And those emotions include happiness, sadness, fear, and anger. So happiness is the perception or the expectation of gaining something, and love is kind of a subset of happiness. Sadness, on the other hand, is the perception that we may lose something of value or that we have lost something that's value, and that makes us feel sad. Fear is a different emotion. Fear is when we perceive there's some sort of a threat or a danger, and then the anxiety or worry emotions are when we have doubts that we'll be able to cope with that fear that we're presented with. And then anger is the last emotion. It's when we perceive there's been a violation or an injustice of some kind, or maybe we're just frustrated by something that we wish or desire to have or to happen. So happiness, sadness, fear, and anger are the core human emotions. Now, if we were all in a seminar room together, which would be a lot of fun, I would do this exercise with you. I would ask each of you to recall a positive memory from your childhood. And what you probably would tell me is about something from your young childhood. Most of us can even remember back to age 3 or 4, probably an interaction with your mom or your dad, or maybe one of your brothers or sisters. But it could be a friend or another family member, but some sort of positive experience that left you with a positive emotion, usually a feeling of love. And you might ask, well, what's the difference between an emotion versus a feeling? That should say emotion versus feeling, not memory versus feeling at the top of your screen. So a feeling, as opposed to an emotion, a feeling is an emotion interpreted in the context of your own personality, the family system that you grew up in, and your culture. And so, how you retrieve your memories is strongly influenced by your feelings. And so, when I asked you the question to remember a feeling, a positive experience from childhood, what you are retrieving is actually a strong feeling inside of you. Some of you may have even felt that in your body, in your chest, or in your abdominal area. And so I differentiate this because a lot of the challenges we have in people who have dementia and have behavioral changes and challenges is because of the way they're recalling their feelings. And that memory retrieval is disrupted. and that can present with a lot of really difficult things when they're trying to retrieve memories or they can't access memories. So we'll come back to that in just a few minutes. So, in his book, The Five Love Languages, Dr. Gary Chapman, who's a pastor and a marriage counselor from here in Winston-Salem, where I live, he wrote this book 25 years ago. It's sold 11 million copies and translated in 50 languages across the world. And he says that the deepest emotional need we have as a human is to love and to be loved. And that's certainly true for most of us who are listening today, and that's true for our loved ones who have dementia. So, the five love languages, what he describes in the book, is an observation from doing marriage counseling in some 10,000 couples over many decades of experience. That he found that people communicate love to each other in five different ways, and these are sort of these ways he called the five love languages, which is a metaphor of literal languages. They're not actual languages, but they're like languages. In the same way that if you were talking to somebody who was from China and they only spoke Chinese and you only spoke English, you'd have difficulty communicating because you didn't speak each other's language. And what Dr. Chapman found is that can happen between two partners in a couple. That if they don't speak each other's love language, they may not communicate and feel the love from one another, even if that love bond actually exists. So these are the five love languages: acts of service, physical touch, words of affirmation, quality time, and receiving gifts. And what I'm going to do now is just briefly describe each one of those. So, if your primary love language is acts of service, you like to do helpful things for other people to lighten their load. Um, and so, an example might be doing dishes or cleaning house, or it's something that the way you show your love is through the things that you do. Physical touch is loving someone by conveying your presence to them through deliberate touch. Most common examples of physical touch conveying love would be a hug or a kiss, and maybe that's your primary love language. The third love language is words of affirmation. So these are unsolicited words of affection or appreciation that you would express to another individual, the most common being, I love you. Very apropos for Valentine's Day today. The fourth love language is quality time. So this is one that we really struggle with in this day of computer devices, handheld devices and computers and all the things that can distract our attention. But loving someone through quality time is by giving them your full and undivided attention. And so maybe that's your primary love language. And then the fifth of the love languages is gifts. So a gift may be something that you purchase, like flowers or chocolate or jewelry, but it can be something that's handmade, like a card, or it can be a gift that you might find that has some meaning to somebody else. And I'll give an example of this later, related to our family's journey with Rebecca. So those are the five love languages. And maybe as I briefly read through those, you thought to yourself, well, gee, one of those really sort of stuck out to me is the way that I like to be loved, or that I tend to express love to other people. And if you were doing marriage counseling with Dr. Chapman or with me, and we were using the five love language framework, one of the questions we talk about is, how do you tend to love your partner, your spouse or your partner? Do you love them in the love language that they prefer to be loved in? Or do you do what most of us naturally do, which is we tend to love others in the love language that we prefer to be loved in? So here's an example of a man who's hugging his partner, and another example of another man who's giving his partner flowers, or maybe she's giving him flowers. You can't tell from the picture. But an example of how the love languages might be used in marriage counseling is, let's say in the picture on the top, The fellow's wife is more of an acts of service person. Maybe she prefers to be loved by acts of service, and he's physical touch. So if his way of showing love to her is with physical touch with a hug, but she's an acts of service person, what may speak more to her would be him doing the dishes for her or vacuuming for her. Or maybe if they were younger, he would sort of take the kids when he got home from work or when they got home from work so that she could just have an hour of downtime and a glass of wine or something. So he could give her all the hugs in the world, but if acts of service was her primary love language, that's the way that she's going to be the most, uh, feel the most loved. The same with the couple in the lower picture. If the primary love language isn't gifts, then even though they're exchanging flowers, or maybe it would be some other sort of gift, that they're not going to necessarily feel loved. So the five love languages in marriage counseling, and this is going to be true when you're trying to love somebody who is struggling with dementia. It's all about what you're giving or you're doing for them to intentionally love them. It's in a sense, it's a sacrificial act on your part. And as Dr. Chapman would say, for a couple struggling in their marriage, that really your focus is on what you do to give 100% to love the other person in the relationship. And by that 100% effort, it's going to have more than double the benefit for you as a couple. So, what have we learned over the years about individuals who have Alzheimer's disease? Well, what we know is that as the disease progresses and they become more cognitively impaired, as their memory fades, as their other thinking and cognitive skills are diminished, like their language function, that the person with dementia, their ability to express love diminishes. And maybe you've noticed this in the loved one who you care for, or if you're a healthcare professional and maybe a client that you have, where that person over time, their ability to express their emotions to you, to be emotionally expressive to anyone, diminishes gradually over time. So the importance is sort of the second thing, and that is their ability, the person with dementia's ability to feel loved, is preserved all the way to the very end of the journey. And I know even with Rebecca's disease, my late wife's disease, that all the way to the very end of her journey, she knew that the girls and I were present to her, and she knew that we loved her, even though the cues that we got from her that she understood that. It might have been a nod or a smile or just a little look that we had from her. Those cues really diminished over time because of her disease. So I think the third thing on this slide is one of the hardest things that I tell care partners when I counsel them, and that is that the depth and the breadth of their love connection with their partner lies almost entirely in their hands. Sometimes a care partner will say to me, "Well, Dr. Shaw, I do so much for him or I do so much for her," and they never express their gratitude. It isn't that they won't express their gratitude, they don't want to. They may feel tremendous gratitude. They just don't have the ability to do it. They can't. It's like memory function in someone with Alzheimer's or some of the other forms of dementia that affect memory. It isn't that they won't remember, they just asked you something. It's they can't. Those brain cells are gone. So it was really the five love languages and my use of them in doing a lot of couples counseling in the counseling center where I work that led to approaching Dr. Chapman and our co-author and the primary author of our book, Keeping Love Alive as Memories Fade, the five love languages in the Alzheimer's journey. And that book is sort of chock full of ways that you can maintain an emotional connection with a person who has dementia, and lots of other practical things about the disease and just about the emotional journey of being an Alzheimer's or just really any form of dementia care partner. So I want to share just a few quick pictures with you of how we use the five love languages in Rebecca's journey with early onset Alzheimer's disease. This is a picture of my grandson Paul, who's 8 now, but this is when he was 3. And Paul is a quality time kid. He always has been. And here he jumped up with his grandma, and he's sitting and coloring with her. You can see where Rebecca colored on the lower left-hand side of the paper, and she just scribbled some color. She enjoyed coloring all the way until 10 days before she lost her battle with Alzheimer's disease. And you can see where Paul colored at the top of the page, and he just jumped up there and he said, "Grandma, I'll help you color." And so this is really from just from the simple acts of a loving child away to spend quality time with his grandmother. This is my youngest daughter, Carrie, who is a physical touch kid like her dad, and she's just sitting with her mom and enjoying a cup of coffee, and they're holding hands together. At this part of the journey, Rebecca had a lot of agitation and she's very unsettled, but a cup of coffee for her and somebody sitting with her would often settle her and allow physical touch to happen. This is a picture of sort of what our evenings look like after work. I would come home and sit with Rebecca on the couch, and we'd spend some quality time together. And I would be able to touch her, and we would watch the DVD player. Her favorite thing was the Sound of Music music video, and she loved to see those old songs from that movie. And I bet you we watched that 1,000 times and learned every single word of every song that was there. It's very helpful when she was agitated to do that. This is one of our paid caregivers, Letisa, and one of the things that Rebecca enjoyed doing, especially later in her journey, was breaking sticks. So Letisa would come early to work and she would gather sticks from the yard, and then they would go out and do this activity, sometimes for an hour or two at a time, called doing sticks. And Rebecca would break sticks into little 1-inch pieces. And this is common in people who have dementia, that they find when their cognitive functions are not so good, doing simple repetitive activities like opening the mail, can even be like shredding tissues. Those repetitive behaviors are calming to them because they can do them successfully, and they don't really mind doing them over and over and over again because they're easy to do. So this was an act of service for Letisa to go out and find sticks. And then this is a picture of Rebecca's favorite gift of all, and that is getting an ice cream cone. So a special love language that's kind of a subset of words of affirmation is music. And I know you've talked about music on an AFA webinar before. And our middle daughter, Leah, is pictured here with her mom. And Leah is a singer and a songwriter and a music person. And she would play the guitar and sing with with her mom, and that was something that would really provide a very settling activity for Rebecca when she was agitated. So I'm bringing you back to this picture because I want to tell you about what I think was the worst day of Rebecca's 9-year journey with Alzheimer's disease. And that happened about 8 months after the picture I showed you earlier. In August of 2013, she and I were sitting on our back porch having our morning coffee together like we did every single day. And I brought Rebecca her coffee and I set it down on the table by her chair, and I was putting cream in for her. And I noticed that the sun was shining through her hair, and you can see she has beautiful blonde hair. And I said, "Sweetie, your hair just looks beautiful this morning." And she looked at me and she had this blank look in her eyes and she said, "I have no idea who you are." And from that moment on, she didn't know the girls and she didn't know me. And we had, the night before, we had been talking about our family. She knew me and she knew the kids, but something happened overnight. And from that day forward, she did not know me as her husband and the girls as our daughters anymore. And I've often wondered, even spending my whole career studying the human brain and what it does, what is it that happened on that day when she lost recognition? And so this is kind of a segue into the last part of the talk. Um, and what I'm going to talk about is this notion of relationship attachment. What happened that day when Rebecca didn't recognize me anymore is that she no longer felt attached to her peeps, her people. And when I tell that story, people in the audience will often have a lot of emotion and they feel bad for me, which is very kind and empathetic. But I want you to now sort of shift your focus and think about what was it like for Rebecca when she looked up at this guy who was serving her coffee and that she had slept in the bed with the night before and she didn't know who he was. And this is what happens with people who have dementia, that as they have memory decline, as their memory fades, they begin to lose the attachments they have with the people in their life. Now, when she lost recognition of the girls and I, this really began the most difficult phase of the journey in caring for her. She started having agitation. She began behaving aggressively. She would say things like, I want to go home, even though we were home. And I'm sure many of you have heard this very common, repetitive phrase that people with dementia say. She resisted care. She fell into a deep depression, and I'll share some reasons why I think that was in a few slides. And she started experiencing sundowning. So this really changed the dynamic of caregiving for her. And this is where I needed to start having paid caregivers to help. And eventually, she required 24/7 care. So let's talk about what is relationship, what is attachment in relationships. So this is now another psychological sort of phrase. Attachment is how one person comes to like or love another person to experience the joy of being together. And in psychology, we call these attachment bonds, and to avoid the dislike of being apart, what in psychology we call separation distress. So, attachment theory, this is described back in the 1950s by a guy named Piaget, a French psychologist. And he said that our very first attachment comes with usually our mother. It's the first parent that we see, and it's our attachment figure, typically our mother, who we seek as an infant nourishment, comfort, safety, and security. And here's kind of a typical picture of a parent holding their young child, and you can see that child looks very safe and secure with his or her mother. So we talk about this notion in psychology of secure attachment. And so a securely attached child is one who is able to interact with strangers and they don't feel threatened by that. They're able to separate from their parents around age 1.5 or 2 without feeling nervous or anxious or worried. They can go out and explore new situations without being fearful. They feel confident and they feel good about themselves. And lastly, people who are securely attached, they're socially connected. That at the beginning of life, they form numerous long lasting attachment bonds with their parents, their siblings, their family, their friends, their coworkers, their spouse, their partner. Eventually, they have their own family and they form secure attachments with them. So that's the notion of sort of secure attachment, as opposed to children who grow up where they're not very securely attached. They have what's called insecure attachment. And that would be because of either the family in which they're being raised or maybe the situation with their parents. It could be even cultural factors that they're more insecurely attached. They feel threatened by strangers, or they're anxious when they're separate from their parents. They're more fearful in new situations, and they lack confidence and self esteem, and they become socially isolated. So they have weak attachment bonds. It could be with their parents, their siblings, family, friends, and then in adulthood, coworkers, spouse, partner, even with their own children. And so, what I'm building a case for is that people who have dementia, as the disease is affecting their emotional attachments, they essentially go from being securely attached or to becoming insecurely attached. And that's what we're going to look at next. So, what happens when a child and a parent become separated? So, here's a picture of a child being pulled away from its mother or father, or just the opposite, the mother or father is walking away from the child. You can see she looks pretty unhappy. What does a child experiencing separation distress do? They cry, they become clingy, and they call out because they feel abandoned. And what they're doing is they're trying to seek their mother or their parental figure and reattach to her or to him. Now, for those of you who are professionals in the audience, what's happening during this time is that as that child senses abandonment and they begin these so called seeking behaviors to seek out their attachment behavior, their brain is cranking out the chemical dopamine. It's anticipating a reward of being reattached, and it's kicking out dopamine. And this is what happens in a person with dementia who feels unattached. Their brain goes into dopamine overdrive, and that's why when medications are used in someone with distressing behavior, the drugs that are used are antipsychotic drugs, which are dopamine blocking drugs, because we're trying to chemically deal with this separation distress. So, how does somebody behave? How does somebody act? What are their emotions like when they have dementia and they're becoming detached? What does attachment have to do with dementia? Well, a lot, because people with memory and cognitive loss, individuals with dementia, are prone to feeling unattached to their people, their loved ones. And they manifest that by separation distress and seeking behaviors. So, in an adult who has dementia, there's a couple ways that the separation distress is manifest. So, on the right, there's more of the seeking response that I just showed you with that young girl who was separated from one of her parents. Anxiety, worry, fear, panic. This is where we see anger, aggression, the distressing repetitive vocalizations like help me. And so this is the seeking response of separation distress. And I think this is responsible for many, if not most, of the challenging behaviors that we see in people who have dementia. But there is also a withdrawn response, and that is that in someone who has prolonged separation and they're not able to reattach to their attachment figures, they may have what I would call like a learned helplessness. They feel sad, they feel depressed, they become withdrawn, they're grief stricken, they're lonely. And so these are both examples of separation distressing behaviors, but they're quite different. And Rebecca experienced a profound depression after she lost identity of the girls and I. And in addition to some of her seeking behaviors, became as challenging to manage as those. So, what is our response as a care partner or as a professional caregiver? Maybe you're a CNA that's working with people in a home based setting or in the setting of a memory care unit or assisted living. How do we respond to people that have these separation distress behaviors? What we tend to do is we distance ourselves from them. If somebody was agitated, they were aggressive, they were crying things out, they were trying to hit you, of course, your natural reaction is that you would distance yourself from that person. But if you think about why it is that they're manifesting these behaviors, why are they saying and doing those things, separating yourself from them only adds to their separation distress. In other words, by distancing yourself from someone who's having separation behaviors, you're doing just the opposite of what that person needs. And that's why I think teaching about attachment is so important, because it helps explain it can help provide for you a more rational approach to why your clients or your loved one, if you're a care partner, why they're behaving the way they are. So the other thing that attachment theory explains is why people who have dementia, and sometimes this is true just as people get older, especially towards the end of life, why it is that they'll often talk to or cry out for a deceased parent. It's almost always their mother. And that's because this is really an example of separation distress and wanting to attach to their key attachment figure in life, who, as I mentioned, is usually mom. So if you have a loved one who is talking to their parent, their mom, or they're even having a conversation with them, maybe they actually believe their parent is there, or it could be another family member. They're doing that not because they're necessarily having delusions or hallucinations. They may be just trying to comfort themselves to be with and experience the safety and security of, if they can't literally have that parent close by, then they're able to do it just by connecting with them in voice. So there are other ways that you can manage challenging behaviors, and I talk about these in a new book that I have coming out May 1st, and I'll show that to you in just a sec. We don't have time to talk about it today because we're coming to the end of my presentation, and I want to get to your questions. But there are a number of strategies that can be very helpful with the information that I've provided for you about attachment, and some other information I share in the new book about just what the brain does and doesn't do in people with dementia, that can be really helpful. And it doesn't involve the use of medication, because in general, if we can avoid using medications, it's really better to do that. And those include things like patience, a strategy that's in my Keeping Love Alive book, and the new book called Acknowledge, Affirm, and Redirect. Another strategy described called Keep It Short, Simple, and Safe. The 5 love languages is a great way for someone who's experiencing separation distress to feel loved and connected. And then reminiscence approaches, where you try and bond the person with their main attachment figures of the past, and music would be a subset of that. So maybe that'll be the topic of another webinar another day. So this is a picture of the new book that I've just finished writing. It's called the Dementia Care Partners Workbook. We will be using this workbook in our support groups at Wake Forest. We do a 10-week, 90-minute per week support group and provide some basic education, and all of that's outlined in this new book. It provides 10 lessons. It could be used by you if you're a healthcare professional to lead a support group. There's a downloadable PDF leaders manual that will walk you through each of the lessons and give you a lesson plan. If you're a care partner, it's also a self-study guide that you could use at home, kind of at your own pace, to learn the same content that we use in our support groups. And if any of you have any questions, I enjoy doing presentations all around the country, and feel free to reach out to me. If you're interested in the Keeping Love Alive book, it's available on Amazon for about $10.50, and then the new book, Dementia Care Partners Workbook, is available for pre-order on Amazon. It's $19.95, and then the publisher is Companion Press. They're the main press for a place called the Center for Loss. and they have it available for pre-order right now at the website shown here, and it's only $16.95, so a little bit less than Amazon. So with that, Heather, I think we're ready to move into the Q&A, and
Yes, yes.
I'll let you take over.
First, thank you so much for today's wonderful presentation. We do have some questions awaiting. Our first question is that the person understands the effects of the cognitive abilities and mobility that Alzheimer's. However, the question that they're asking is, uh, what specifically about Alzheimer's causes death?
What causes the physical death of the person, like them to lose their life?
Yes.
Um, so, Alzheimer's disease, and I think this is probably true of other forms of dementia as well. They fall under the category of neurodegenerative diseases, which is kind of a fancy word that talks about the main cells of the brain called neurons. They become sick and then they don't function as well, and then eventually they die. And so, a person who has Alzheimer's or another form of dementia, their brain shrinks because they are losing their brain cells. Eventually, that process involves the core of the brain called the brain stem. And the brain stem not only hooks your brain up to the rest of your body so you can, think and feel and do, but your brain stem also controls your heart rate and your blood pressure and your breathing. And so, in the late part of the disease, when those core functions are affected, eventually the brain will turn off and the person's heart won't work anymore, or their breathing will stop. And usually those things go together. And that's what causes the end of life.
Thank you. We have another question. Again, everyone on the right-hand side, you could type in your questions or comments, and I'll be reading them. So another question, what about CBD oil? I think the person was referring to when you were saying about the interventions. I think this question is referring to about the usage of CBD oil with Alzheimer's, if you know any updates with that, if there is any.
Um, so, CBD oil, which is one of the components of marijuana, it's the part of marijuana that doesn't make you high. Um, CBD oil is being researched now in a whole variety of neurological diseases and other chronic health conditions characterized by inflammation. So, inflammatory diseases include things like inflammatory bowel disease, or MS, or Parkinson's disease, and dementia would be another. Um, so different uses for CBD oil have included things like pain, seizure disorders, and conditions like anxiety or even like agitation and aggression. So I will say that there's not a lot of research for the use of CBD oil specifically in the setting of dementia. I think it's a reasonable area to explore this. Um, CBD oil has relatively little in the way of side effect, and I think the person would have to work with their physician to see if they were interested in trying to explore whether that was helpful for uh, a person with dementia, maybe some of the agitation or aggression or anxiety or depressive symptoms that they were experiencing. I will say that I have used medical marijuana, usually in the form of Marinol, which is a prescription form of marijuana, or somebody just smoking marijuana, um, in people who have agitation or aggression with Alzheimer's disease. And I've found it helpful when other sort of usual approaches don't seem to work. So I think the bottom line is right now, if we're looking for medical research or evidence, we don't have a lot for the benefit of CBD oil, but I think there's a lot of promise there.
Thank you. Another question is referring to your book. Does the book, Keeping Love Alive as Memories Fade, touch on what we learned today? talking about the attachment, etc.
We do talk about attachment a little bit in the Keeping Love Alive book. We have just sort of part of a page that talks about attachment. Because following the publication of that book and the speaking engagements I've had related to that book, there's been much more interest in attachment. I developed the notion of attachment much more in the new book and have it as a much more central theme in the chapter that describes behavior challenges and approaches to trying to work with people with dementia who have those challenges. So it is in both, but a bit more in the newer book that's coming out.
Thank you. Another question is my husband's living in a facility and he's in more of the moderate stage, so verbally he really isn't speaking now. So how could I implement some of these love languages when I visit my husband?
Yeah, so that's really a great question. Some uh, Not all the love languages require that you talk to the person or that they understand you. So if you go back to the handout, so for instance, quality time is really just being present with that person and giving them your full and undivided attention. So you could couple with quality time physical touch. So if this this woman's husband doesn't mind being touched, then she could hold his hand, or sit alongside next to him, and where they could hold hands, or she could put her arm around him, so she could give the quality time and be present to him in touch, even though he may not show her that he understands words of affirmation. It's likely that most people do understand what's being spoken to them, even if they've lost the ability to communicate. So, language in Alzheimer's disease is one of the last functions that's lost. And a person may understand the words, I love you, even if they can't say those words back. An act of service. She could maybe give him a back rub, or read to him, or sing to him. That would be another way where he wouldn't have to necessarily participate in that, but he could be the recipient of that. And the same is true with a gift. She could give him a piece of candy, or um, you know, do something, give him a handmade card maybe that he might enjoy, even though he might not be able to read the card, let's say. So all the love languages can be used, even if the person is more of a passive recipient of those love languages. And that's why in the talk I emphasize that using the love languages is an act of sacrifice on the part of the care partner or whoever's visiting. It's something that you're doing for the benefit of them.
Thank you. Another question is from a person whose wife has this disease, and he feels that um, the relationship is very much one-sided right now, and he wants to know how, in being a caregiver, how he can just recognize every day the love that he has for his wife, because sometimes he just gets very frustrated.
Yes. Well, how he's feeling, I think, is this is a normal emotional response to the very challenging situation where uh, you know relationships are normal relationships are two-way streets, and so there's give and take in relationship, and a person who has dementia, their ability to give in that relationship is diminished, and sometimes it's dramatically diminished as you get in the middle and later stages of the disease. So I think this is one of the really hard things that we have to face as a care partner, is that we're going to be giving more in the relationship. That Something Dr. Chapman says in his book, that 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 the relationship is not about the thrill of romance, but the security of the faithfulness that you have to find value in the fact that you are committed to your partner and you're loving her and caring for her despite this terrible journey. And so and that you find meaning in doing that, being able to provide the best care possible. And yes, you grieve those losses, and that's why if she's not able to talk, if he's not able to talk with her and she can't respond back, that he would need to really find someone that he can talk to, a family member that he can confide in, or maybe a counselor, a mental health counselor, where he can talk about, gee, I've really lost a lot by not having this give and take in my relationship with her. And one of the things that I could share from my journey with Rebecca was that there were times, especially in the middle or later part of the journey, where um, all that I would get back from her would be a smile or a nod, or sometimes a chuckle, or sometimes I would hold her hand and she would squeeze my hand a little. And even though that wasn't much, like in the earlier years of our relationship, we were very touchy feely and always holding hands and kissing and arm in arm. But that wouldn't have been much. But later in our relationship, when she had dementia, those little things meant so much to me. And a little squeeze of a hand or a little laugh or chuckle could sustain me for a whole week. That she actually knew that it was me. And you have to sort of change that way as a care partner. So I admire this gentleman's desire to keep that bond going, and I would just encourage him to say that you can find emotional intimacy even in the later stages of the disease. It's a lot harder. It takes more work, but it can be there.
Thank you. We have another question. How do caregivers cope with this transition?
Um, so I'm going to take a guess and say cope with the transition like Rebecca had, where she didn't recognize us and then moved into this phase of her disease where she had the agitation and aggression on one hand, and some of the depression on the other hand. So this is really hard. In the new book, the Dementia Care Partners Workbook, um, one of the chapters of the book is called "Getting More Help," and this is really kind of the front row and center notion in that chapter, is that there becomes a point in the journey when you just can't manage on your own. That if you're the sole care partner of your loved one, that some of these behaviors plus some of the physical changes that come with middle and later stage dementia. So this is the point where Rebecca started having some incontinence. That's where I needed help. And so I sought a home health agency and had professional caregivers starting to come into the home because I couldn't just manage on my own anymore, and or the kids and I couldn't manage on our own. Um, and I think, Heather, this is also the point where you begin to get some challenges in some of the physical issues with dignity. Like, do we want to do certain things? So, my daughters, for instance, they were not comfortable doing toileting assistance or helping shower their mom. They felt like, that was something that would threaten their mom's dignity with them as their daughters, and they wanted professional caregivers to do that. And when Rebecca didn't recognize me anymore, she didn't want me to help her shower. So I think there are lots of reasons why, when you get to a certain point in the journey, the way you manage is you have to get help. So I say, we say in both books actually, the dementia caregiving is a team sport. You have to assemble a group of people, and sometimes you have to be proactive in going out and seeking that help.
Thank you. We have another question about the Dementia Care Partner Workbook. Is that something that it's train the trainer? How can we implement that in our program if we're interested?
Um, so the workbook will have associated with it a leader's guide, and the leader's manual will talk about just the basics of um, starting a group like this, how to advertise for the group, where you can hold the group, some essentials of kind of group dynamics. Um, and then it'll have lesson by lesson instructions on how to run each particular lesson. You could do a 10 week group where it was 90 minutes to 2 hours per session. You could do a longer number of sessions because the lessons are pretty chock full of information. You could select lessons if you wanted to do less than a 10-week group. It's pretty much everything you would need to start your own group. So we made the Leader's Guide a downloadable PDF so you could share that with whoever your co-leaders or co-facilitators might be, and then the participants would each need their own unique manual because there's lots of opportunity for journaling in the manual. And so we ask lots of questions, and those questions form the basis of the discussion. So essentially, what I wanted to do was reproduce the program we have so that anybody could start a similar program in their community, wherever they were. And if somebody wanted help to jumpstart a program, like if you were in a health system and you wanted to do support groups across your health system, that's I do consulting, and could come and help sort of get you going with that as well. But you could really do it by the workbook and purchasing just one copy of the leader's manual for your co-leaders.
Thank you. Another question, one more question is that besides Keeping Love Alive, do you have any other books suggested for relationship building and growth?
Yes, there's a book called Creating Moments of Joy. Um, the author's name is Jolene Brackey. Um, and in the relationship space, that's my other very favorite book. I think the book, The 36-Hour Day, has, if you look in the, it has a very thorough index, and it has some sections that deal with relationships. So those would be a couple of commonly available books that are there and would focus on this as well.
Okay, well, we are done with the questions for today. Oh, nope, I'm sorry. Oh, we have a thank you. We've had many thank yous. I'm going to get to that for your presentation. We had many people saying that they loved today's presentation, that they learned a lot, and it was really something that meant a lot to them. So, our listeners are thanking you, and I'm thanking you for today's presentation. I want to wish everyone again a beautiful Valentine's Day, and thank you for joining us on this Valentine's Day. And as always, we will be available next month for our presentation in March. And if anyone has any questions, they could always call our helpline at 866 232 8484. We're available Monday through Friday, 9 a.m. to 9 p.m. Eastern Time, and Saturday and Sunday from 9 a.m. to 1 p.m. Eastern Time. Again, Dr. Shaw, I can't thank you enough for volunteering your time, your expertise, and your personal story. And I want to thank everyone else. I hope everyone has a good rest of their day.
Thank you.
Thank you. Have a good day. Bye bye.